Welcome to this module, Alzheimer's Disease, a Public Health Crisis. This course is part of a curriculum for public health students entitled A Public Health Approach to Alzheimer's and Other Dementias. It was developed by the Emory Centers for Training and Technical Assistance for the Alzheimer's Association, with funding from the Centers for Disease Control and Prevention. During this module, we will discuss the epidemic of Alzheimer's and other dementias, and why it is an important issue for public health to understand and act on. At the end of this online course, you will be able to provide a general description of dementia and Alzheimer's disease, explain the current and projected scope of the Alzheimer's disease epidemic, discuss the cost burden of Alzheimer's disease for federal and state governments and individuals and their caregivers, describe the care burden of Alzheimer's disease, including caregivers and the healthcare system, identify health disparities related to Alzheimer's and dementia, and explain why public health must play a role in addressing the Alzheimer's disease epidemic. Let's begin with an overview of Alzheimer's disease and dementia. For many years after its discovery in 1906, Alzheimer's disease was primarily viewed through the lenses of medical care and aging. There are valid reasons for this. Medical care is an essential component of identifying and treating individuals with Alzheimer's disease, which primarily affects older populations. Aging services such as community programs and services aimed at assisting seniors are often a vital source of support for people with Alzheimer's and other dementias. Increasingly, the disease is being understood as a public health issue. Alzheimer's disease affects more than just individuals, their families, and others in their medical care and support teams. The impact of Alzheimer's disease is felt at national, state, and local levels through financial burdens, infrastructure and resource needs, and professional requirements. It is a growing epidemic that has profound social and economic implications, especially given the current trends of the aging population. As more is learned about Alzheimer's disease and its impact, it becomes clear that a multifaceted response by public health, the healthcare sector, governments, and within communities is vitally important to address the growing crisis within the United States and throughout the world. It is first important to understand what characterizes dementia. Dementia is a general term for a decline in mental ability severe enough to interfere with daily life. Dementia is not a specific disease. It is an overall term that describes a wide range of symptoms associated with a decline in memory or other cognitive skills. Many dementias are progressive, meaning that symptoms start out slowly and gradually get worse. In the most severe stages of dementia, a person must depend on others for basic activities of daily life. Certain brain diseases and other health conditions cause dementia. Alzheimer's disease is the most common type of dementia. It accounts for an estimated 60 to 80% of cases. Alzheimer's is an irreversible, progressive brain disease that slowly destroys memory and thinking skills, and eventually the ability to carry out the simplest tasks. Symptoms usually develop slowly and get worse over time, becoming severe enough to interfere with daily tasks. There are currently no known ways to prevent, cure, or slow the progression of Alzheimer's disease. The image on the screen shows a healthy brain on the left side as compared to a severe Alzheimer's brain on the right side. The Alzheimer's brain is significantly smaller than the healthy brain. Let's listen to Dr. Dean Hartley, Director of Science Initiatives at the Alzheimer's Association, speak about the effect that Alzheimer's disease has on the brain.
The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells, or neurons, throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
Now that you have a basic understanding of Alzheimer's and dementia, we will turn to how widespread these conditions are. Alzheimer's disease must be considered a public health crisis. There are many reasons for this. First, the burden is large, and it is growing. Today, over 5.7 million adults in the United States are living with Alzheimer's, including an estimated 200,000 people under the age of 65. 1 in 10 adults aged 65 and older currently has Alzheimer's. Approximately 1 in 3 people aged 85 and older is affected or is living with Alzheimer's dementia. Women make up almost 2/3 of seniors living with Alzheimer's in the United States. The rates of Alzheimer's and other dementias also reveal certain health disparities. In the U.S., African Americans and Hispanics have higher rates of Alzheimer's and other dementias than people of other races and ethnicities. In the U.S., older African Americans are about 2 times more likely than older whites to have Alzheimer's and other dementias. Older Hispanics are about 1 1/2 times more likely than older whites to have these conditions. Large proportional increases are also expected in both of these populations in the United States, which will contribute significantly to the growth of the epidemic. Limited data exists about the prevalence of Alzheimer's disease in other racial and ethnic groups, including Asian Americans and American Indians and Alaska Natives. Alzheimer's disease is the 6th leading cause of death in the United States and the 5th leading cause of death for those aged 65 and older. Deaths from Alzheimer's disease increased 123% from 2000 to 2015. Alzheimer's disease is the only cause of death among the top 10 in America that cannot currently be prevented, cured, or even slowed. Compared to other top causes of death in the United States, deaths from Alzheimer's have increased significantly, while deaths from others have declined. From 2000 to 2015, the percentage changes in deaths are as follows. HIV declined by 55%. Stroke declined by 16%. Heart disease declined by 11%. Prostate cancer declined by 7%. Breast cancer declined by 1%. Alzheimer's disease increased by 123%. The number of people living with Alzheimer's and other dementias will continue to grow each year as the number and proportion of the U.S. population aged 65 and older continues to increase rapidly. 2 of the reasons for the increase can be attributed to people living longer and the large increase in the number of people over age 65, or baby boomers. By 2030, the U.S. population aged 65 and older is expected to double. By 2050, the number of Americans living with Alzheimer's disease is expected to total 13.8 million and could be as high as 16 million. Today, someone in the United States develops Alzheimer's every 65 seconds. By 2050, that rate is expected to increase to 1 person every 33 seconds. Worldwide, the total number of people with dementia, including Alzheimer's disease, is estimated at over 47 million. This number is projected to nearly double every 20 years, to 76 million in 2030 and 145 million in 2050. The total number of new cases of dementia each year worldwide is nearly 7.7 million, which equates to one new case every 4 seconds. The escalating Alzheimer's disease epidemic has profound implications for government budgets. Let's look at the financial burden. Alzheimer's disease is the most expensive disease to treat and provide care for in the United States, costing more than heart disease and cancer. In the U.S., the annual costs of direct care for people with Alzheimer's disease exceed $200 billion. Direct care includes both paid health care and long-term care. It does not include caregiving, which is an essential part of Alzheimer's care, and will be discussed later in the module. Worldwide, the annual costs of Alzheimer's and other dementias are estimated to be over $818 billion. Alzheimer's disease imposes a significant cost on federal and state budgets through Medicare and Medicaid. Medicare is a federally funded health insurance for people aged 65 and older who are U.S. citizens or legal permanent residents, or people under 65 with certain disabilities or end-stage renal disease. Medicaid is a program funded by both federal and state governments to help with medical costs for some people with limited income, limited resources, or other qualifying situations. Medicare does not cover the cost of long-term care for assisted living, nursing homes, or in-home care such as certified nursing assistants or home health aides. Medicaid will cover the cost of nursing home care for low-income individuals, or once an individual has limited personal assets and/or may require that the majority of the individual's monthly income go to cover nursing home care expenses. These facts underscore the significant costs facing Medicare and Medicaid as a result of the Alzheimer's disease epidemic. About 67% of the health and long-term care costs of caring for those with Alzheimer's disease are paid for by Medicare and Medicaid. In 2016, the Medicare and Medicaid government programs will spend an estimated $186 billion caring for those with Alzheimer's and other dementias, 67% of total annual costs of these conditions. Nearly 1 in every 5 Medicare dollars is spent on people with Alzheimer's and other dementias. Average per person Medicare spending for those with Alzheimer's and other dementias is 3 times higher than average per person spending across all other seniors. Medicaid payments are 23 times higher. People with Alzheimer's and other dementias have high out-of-pocket costs. These costs are for Medicare and other health insurance premiums and for deductibles, co-payments, and services not covered by Medicare, Medicaid, or additional sources of support. Just as the number of people with Alzheimer's disease is projected to dramatically increase, so will the costs associated with their care. If current conditions go unchanged, in 2050, the annual costs of treating Alzheimer's disease in the United States will be over $1.1 trillion. Annual costs to Medicare will increase over 400% to $589 billion. This would represent nearly 1 in 3 Medicare dollars. Out-of-pocket costs for individuals and families affected by Alzheimer's and other dementias will increase about 350%, from $44 billion in 2015 to $198 billion in 2050. Cumulatively, between now and 2050, total costs of caring for people with Alzheimer's and other dementias will be $20.8 trillion. Nearly 70% of those costs will be paid for by federal and state governments. The burden of care associated with the Alzheimer's disease epidemic is also a significant and growing challenge. Let's explore why. People with Alzheimer's and other dementias are generally cared for by a network of family or friend caregivers, healthcare providers, and paid care providers, such as those who help with daily tasks and self-care. Most individuals with Alzheimer's disease have a primary caregiver, often a family member, who is crucial to ensuring appropriate care. The type and scope of the care needed by people with Alzheimer's disease changes throughout the course of the illness. In the United States, 83% of the care provided to older adults comes from family members, friends, or other unpaid caregivers. About 65% of people with Alzheimer's dementia live in home settings, with the vast majority of their care provided by family and friends. Currently in the U.S., it is estimated that over 16 million family and friends provide nearly 18.4 billion hours of unpaid care annually. In 2015, this care was valued at $232.1 billion. This is approximately 48% of the net value of Walmart annual sales, which was $481.3 billion in 2017, and nearly 9 times the total annual revenue of McDonald's, which was $24.6 billion in 2016. The term caregiver is used to describe spouses, partners, adult children, other relatives, and friends providing unpaid help to people living with dementia who have at least one limitation in their activities of daily living and reside in the community. This does not include paid help such as home health aides, which we'll discuss shortly. Caregiving responsibilities, especially in the moderate and severe stages of Alzheimer's disease, often include help with dressing, bathing, toileting, and feeding, shopping, meal preparation and transportation, medication management and financial management, and providing emotional support. People with Alzheimer's require increasing levels of caregiving as the disease progresses. Often, the severe stage requires constant supervision and extensive or complete dependence on caregivers, whether paid or unpaid. Caregivers of people with Alzheimer's and other dementias often experience physical, psychological, and social challenges. Several recent findings highlight these challenges. Due to the physical and emotional toll of caring for someone with Alzheimer's or other dementias, these caregivers had $11.4 billion in additional healthcare costs in 2017. Nearly 60% of Alzheimer's and dementia caregivers rate the emotional stress of caregiving as high or very high. About 40% of Alzheimer's and dementia caregivers suffer from depression. In many cases, caring for an individual with Alzheimer's has a negative effect on employment, income, and financial security. Among Alzheimer's and dementia caregivers who are employed full or part-time, 57% said they had to go in late, leave early, or take time off because of their caregiving responsibilities. 18% had to go from working full-time to part-time. 16% had to take a leave of absence. And 9% had to quit work entirely, either to become a caregiver or because their caregiving duties became too burdensome. Caregivers of individuals with Alzheimer's and other dementias spend much more time providing care than caregivers of individuals with other conditions. In 2014, of the unpaid Alzheimer's and dementia caregivers, 75% had been providing care for at least a year. 33% had been providing care for 5 years or more. The average length of time caregivers in general report providing care is 4.6 years, but in the cases involving dementia, caregiving may range from 4 to 20 years. The burden on caregivers is significant. They play a critical role in supporting individuals with Alzheimer's and dementia, yet often do not receive the education or support needed to provide effective care and protect their own health. Without caregivers, the healthcare system could not sustain the costs of care for persons with Alzheimer's and other dementias. Assuring caregivers receive needed support is a public health issue. With the growing number of older adults in the United States population, both with and without Alzheimer's and other dementias, the country is facing a workforce shortage of healthcare professionals who are trained to meet the needs of older adults. Furthermore, many professionals already in the workforce are not adequately trained on the needs of people with Alzheimer's and other dementias. Current estimations of workforce shortages include the U.S. will need an additional 3.5 million healthcare professionals by 2030 just to maintain the current ratio of healthcare professionals to the older population. The U.S. has approximately half the number of certified geriatricians than it currently needs. Less than 1% of registered nurses, physician assistants, and pharmacists identify themselves as specializing in geriatrics. Many older adults, including those with Alzheimer's and other dementias, receive a large part of their care from direct care workers, such as nurse aides, home health aides, personal care aides, and home care aides. These workers help with bathing, dressing, eating, and numerous other daily tasks, both at home and within institutions. Paid caregivers typically cost $20 per hour or $160 per day, an expense that most families pay out of pocket. Challenges within the direct care workforce include workforce shortage and insufficient training. Turnover rates are high among direct care workers, and recruitment and retention are persistent challenges because of home health aide workforce shortages and competition from other employers offering better pay or work hours. The workforce shortage in paid caregivers is becoming severe in some regions of the country, particularly in rural areas. Many direct care workers receive little training on Alzheimer's and dementia care. Average training is 75 hours, with little focus on Alzheimer's and dementia. The Paraprofessional Healthcare Institute estimates that between 2016 and 2026, the direct care workforce is projected to grow by 30%, from 4.4 million to 5.8 million workers. Fortunately, there are ways to intervene using public health tools and techniques. The public health approach can be used to improve the quality of life for people living with the disease, their caregivers, and to reduce the costs associated with the disease. For the first time, Alzheimer's and other dementias are included in Healthy People 2020. Healthy People, released every 10 years by the U.S. Department of Health and Human Services, is a framework of goals and objectives that is used to guide national health promotion and disease prevention efforts in the United States. The new topic area, dementias, including Alzheimer's, contains specific objectives regarding increasing diagnosis and awareness and reducing preventable hospitalizations. Public health has a role to play in reaching those objectives. Inclusion in Healthy People 2020 underscores the growing public health threat that Alzheimer's and other dementias pose to the nation. Public health plays an important role in addressing Alzheimer's. 3 key public health intervention tools can reduce the burden of Alzheimer's disease. First, surveillance and monitoring that allows public health to compile data and use it to develop interventions, inform public policy, evaluate programs and policies, and educate populations. Secondly, using primary prevention strategies to reduce risk for dementia, as well as promote cognitive health in general, including informing the public about ways to protect brain health, identifying and promoting strategies like helmet laws that reduce traumatic brain injuries and other dementia risks. Thirdly, public health may play an important role in efforts to increase early detection and diagnosis of Alzheimer's disease, including educating the public about the warning signs of dementia, and the benefits of early detection, training healthcare providers, and improving access to information and helpful tools for newly diagnosed individuals, families, and their caregivers. A dementia-capable system is a system or infrastructure that works to meet the needs of people with dementia and their caregivers through providing education, support, and services. Public health has a role to play in supporting dementia-capable systems and dementia-friendly communities. At a larger level, states and communities can become dementia-capable and accommodate the needs of a population with Alzheimer's and other dementias. Public health can contribute to a dementia-capable system through helping educate the public about dementia, analyzing the community support needed by people living with dementia and their caregivers, ensuring access to and promoting use of evidence-informed services for people with dementia and their caregivers, workforce training and education for professionals who interact with people living with dementia. Public health can also support the dementia-friendly community movement, in which stakeholders make changes to support people living with dementia and their caregivers. In this course, you've learned about dementia and Alzheimer's disease, about the current and projected scope of the Alzheimer's disease epidemic. You've heard about the cost burden of Alzheimer's disease for federal and state governments and individuals and their caregivers. You've learned about the care burden of Alzheimer's disease, including caregivers and the healthcare system. You've heard about health disparities related to Alzheimer's and dementia, and you've learned why public health must play a role in addressing the Alzheimer's disease epidemic. Thank you for your attention and interest in this module, Alzheimer's Disease, a Public Crisis. For more information on the topics covered, please visit the Alzheimer's Association's website at alz.org/publichealth or visit CDC's website at cdc.gov/aging. There you can find resources, the latest research, and more information.